Bismillahirrahmanirrahim. This is the third part uh, of this lecture. Previously, I have explained you the process of disinfection, different instructions regarding disinfection and biosecurity, which factors they pose risk to the biosecurity of farms, different disinfectant which are recommended to be used at the farm level. And now I will be going to metaphylaxis. What is metaphylaxis and its details? But before I go to this prophylaxis, I want to explain a few things. First of all, we have to understand that the species which can pose risk to the biosecurity of the farm species or first of all, I will be talking about there is an interaction between different products which are from agriculture sector. Uh, they can be from industry, or there can be some environmental pollutants, or some veterinary medicines which are being used as animal feed additives, and human medicines uh, which is being used at hospital level um, in a human being. So this is some sort of I would say a cycle of movement of antimicrobial resistance from animals to human. So the base is this point. Then now, antimicrobial resistance basically is an ineluctable adverse effect of antibiotics use. So the association between the consumption of an antimicrobial agent and the occurrence of antimicrobial resistance is well established. So that is why the prudent use of antimicrobiotics requires to reduce the overall consumption. In this, basically, I would say picture, you can see the use of antibacterials or antimicrobials, antibiotics at different levels for different functions. For example, uh, at some time point in European Union, it's banned now in European Union, but in Pakistan we are still using some antibiotics as growth factor in animals, especially in poultry industry. This use of antibiotics in animals at a low dose uh, is being used for the prevention of the disease. And when a disease occurs in animals, we also use antibiotics to control the disease in animals. And sometimes we are using as the medicines or antibiotics for therapy purposes. So what is the difference between prophylaxis and metaphylaxis? Uh, Whether these are both the same types. So when antibiotics are administered to a herd or a flock of animals at risk of a disease outbreak, I mean before the occurrence of the disease, this thing is showing that for prevention. So a measure which is taken to maintain health and prevent disease, or a measure to protect against infection, is known as prophylaxis. So this is prophylaxis before the occurrence of the disease. The next is metaphylaxis. When antimicrobials are administered to clinically healthy animals belonging to the same flock or pen as animals with clinical signs. Uh, Actually, metaphylaxis is basically to control the disease, or Metaphylaxis, the terminology, it refers to the situation where antimicrobials are used for both therapeutic and for both prophylactic purposes. So it's a particular form of, we can say, prophylaxis in the presence of the pathogen with a high likelihood of disease. I would say that before the clinical appearance of the disease, when we use these antibiotics, these are the use of this the antibiotics is known as metaphylaxis. So phylaxis means protection. Phylax basically guard or watchman. So, in relation with the start of this aggression, before the aggression begins, means before the pathogen attacks the animals, we use antibiotics. We use the antibiotics so that at that time, this use of antibiotics is called as prophylaxis. And when the pathogens have attacked the host, but their clinical signs have not appeared yet. I'm repeating it, that when a pathogen has attacked the healthy animals and has not shown the clinical signs or has not appeared at a clinical level. So then we apply these antibiotics, and at that stage, the use of antibiotics is known as metaphylaxis. So before the start of the infectious disease, we can say that we do prophylaxis, and after the attack of the bacteria, when we try to control this pathogen to show the clinical signs in animals, this is known as metaphylaxis. So I think I have tried my best to use this terminology. So if we compare the prophylaxis and metaphylaxis, these two terminologies, I would say that prophylaxis is a preventive act, whereas metaphylaxis is a curative treatment or early curative treatment when no symptoms have appeared. But after the symptoms have appeared, when you use antibiotics, then it is a kind of metaphylaxis, but it's post curative treatment. It will be called as post curative treatment. So I think that was all about this prophylaxis and metaphylaxis. If you have any question, you can ask me now. Thank you.